In this video, let's talk about hip impingement. Hi, welcome back. This is Wei, your exercise physiologist, here to help you better understand your body so that you can improve in your health, fitness, and performance. Now, if you don't want to miss any videos that I post over here, don't forget to click on the subscribe. Don't forget to hit on the bell button, because this way YouTube will notify you when I post a video. Right, so hip impingement. Let's break this word down, because impingement can happen in a few places in your body. Right, so obviously hip, you know about that area, and impingement, basically you want to think of impingement like so we're talking about hip over here. This is your hip joint. It's more like a socket joint, and this is your femur bone. Right, so basically this bone is coming in here, and if an impingement happens, what's happening here is that it's going to be rubbing against this, right? And this basically is impingement. You can easily find this especially in your shoulder joint and also your hip joint. And you realize these two joints have this very common similarities. Both are actually socket joint. Basically, your shoulder and your hip can actually be moving in various directions. Okay, and for the hip, weakness of the muscle, a compensation, overloading can actually cause this impingement to happen. And when we talk about this word, this just means that if there's like the tendon, the muscle, what else? The bone is actually pushing into this area and it's causing inflammation to the bursa. If you haven't watched my previous video about the bursa, you can click on this link over here. So it is also commonly known as the femoral acetabular impingement. It basically means the same thing. You will later on understand why this is also called this term, right? Basically, hip impingement, it's the very layman term. In terms of diagnosis and all this, a lot more medical professional will use femoral acetabular impingement. It's the same thing, right? And we'll go to the 3D model. Let me show you what's happening over there, and then we'll come back over here. Right, as mentioned, the hip impingement is also known as the femoral acetabular impingement, and this is the reason. So let's remove the muscles and let's go deep in there so you can understand what's happening over here. And when we talk about hip impingement, like I said, it's actually the hip rubbing against each other, and these two bones are basically the ones. So this is basically the bone that we're talking about, your pelvic bone, right? And then we have your femur bone, right? At this junction, if I have to remove everything, this is the junction that we're talking about, and this is what people will talk about hip impingement and femoral acetabular impingement. This is where the name comes from. Basically, this tissue over here, like you see, is basically your acetabular, right? It is also called the labrum. Okay, and when you have this bone, which is your femur bone, rubbing against this guy over here, this creates the acetabular or femoral acetabular impingement, and that's what's giving you all this impingement pain, right? So this is basically it. You really want to get this guy sorted out, but most of the time, like I said, the pain is just telling you that something is going on there. So even before coming into why this bone is actually rubbing into this, which we can sort out the pain easily by taking painkillers or anti-inflammatory pills, anything that's just very fast and effective. But because of your lifestyle, because of what you have been doing daily, there may be something, could be action, could be sports, could be activities, especially physical ones, that can actually cause this impingement to happen. All right? So if we bring in the tissues around here, you realize that movements caused by the muscle can actually change the direction and change the force of where or what this bone is trying to do. Okay, so if you take a look at it, there are actually so many muscles that can actually bring this guy in a different position. Okay, so when that happens, think about it. It's basically supposed to be a very smooth gliding joint, right? It's supposed to articulate around this area very smoothly, but because of a lot of different things happening, impingement can happen. Now, a lot of times we're just focusing too much on the impingement. Or rather, what I hear from patients, they don't really know what's happening. So most people just care about the pain and they just want to get rid of the pain. But the main thing over here is you need to understand what's causing the pain. So things like painkiller, things like resting, things like icing, it's just, to me, quick fix. You do get the pain away, but you do not get to the root of the problem, because all this is just sorting out the pain. So once you understand what's causing the pain, it's a lot easier. And most of the time, like I mentioned earlier, it has to do with muscle imbalance, it has to do with compensation, it has to do with overloading, it has to do with muscle weakness. So take for example, we have somebody who's going to the gym, and this guy haven't feel pain for the longest time, but he has been progressively loading in the gym, and just one fine day he starts feeling some weird sensation, some soreness, some achiness around the hip, but he chooses to ignore, and this eventually gets built up, and over time this becomes his hip impingement. This is very common, and I've seen it in quite a number of athletes, and my advice usually to them is, if they have already found or felt something, don't choose to ignore, especially if it happens again and again, because that already tells us that something is already happening. And if you get it sorted out quicker, basically we get all the problems sorted out even quicker. So you basically short down the time frame for yourself to recover. And for athletes, this is my advice. Because sometimes when you choose to ignore, some other complications can happen, and it can actually make things worse, and it can actually also make the diagnosis a little bit harder. Alright, so this way the doctor's job basically it's a lot harder, because if he is only looking at the pain and not looking at how it actually progressed to this stage, looking at the history, what you have been doing, it can be also a misdiagnosis. Things like that do happen. Right, so that's all I have for you today. If you like my video, don't forget to hit the like, and if you have any questions, don't forget to post it on the comment section below. And if you haven't subscribed to my video, don't forget to do it as well, and hit the like button. So this way YouTube can actually notify people who are actually looking at similar content, and just let the algorithm do the work. Right, need your help there. Thank you, and I will see you soon. Take care. Bye bye.